Hey everyone, I am finishing up my hike today and I thought I would talk about multivitamins for kids. When I see adults in my office, I would usually want to make sure that they don't have any medical conditions and then treat anything I might find as far as a medical condition or a deficiency, and then hopefully teach nutrition, mindful practice, and activity so that they can get off either their prescription medicines or, in some cases, supplements. So try to encourage a child to take a pill once a day. And again, knowing that most of my American adults are not maximized on a good nutrition plan, I would only assume that their kids would have the same deficiencies as the parents. So in assessing a child or an adolescent, I always want to make sure that we first identify medical problems. When I see patients that are already on prescription medicines, then sometimes some of those medicines can cause deficiencies, nutritional deficiency. So it's important that whoever is giving the prescription medicine should also look into what that prescription medicine might cause as far as a deficiency in due time, and then prepare for it by testing. Now, you all know that kids do not like getting blood tests, and passing out is a common problem, or throwing an anxiety attack or temper tantrum before the blood test is done is always a challenge. So in some cases, if the parent has it, like a deficiency in vitamin D or iodine or magnesium or B12, then I'll just go ahead and assume that the child has it. But here's the tough part. Getting a child or an adolescent or a young adult to take a pill every day is a bit of a challenge. And there are some schools of thought in Western medicine, or at least with my colleagues, that supplementation doesn't make a difference in the long run. And I read that study too, and I think it was underpowered personally, but I look more into deficiency. I use evidence-based medicine to figure out what deficiencies my patients might have, which medicines might cause a deficiency, or rob that patient of different things, like for example, Protonix, omeprazole, Prilosec, Prevacid, Nexium. They are all great for causing reflux, but did you know that they also decrease protein absorption, and because they shut down acid, rob you of B12 and iron? So it's important, if you're on those medicines, to have your doctor check once a year. Just in the case of those medicines which are over the counter, it's important to take care of deficiency for fear that you will end up with symptoms. A lot of my patients will come in and be on several different supplements. If I was to have a child, a pretty healthy child, with no symptoms, a good body weight, no medical problems, the most important thing for that child is to get used to taking a pill every day, probably a chewable. I mean, I can think about probiotics or vitamin D, standard multivitamin, especially if they're vegetarian. That includes B12 and iron. But more importantly, because I think most kids are pretty bulletproof. They have furnaces as stomachs and they can digest anything, and usually they don't have too many stressors, not until they get to college. So I just get into the habit of having that child take a chewable pill. I'd probably pick the most important thing we're trying to take care of, and maybe a probiotic or a fish oil of some sort, and then get used to taking the pill. And empower that person to take something on a regular basis every morning. As long as there's no side effects and as long as it's not expensive, it might not be getting in, but if I can get that child to get into the habit, then hopefully they'll go into college, independent life, with the practice of taking something supplementation-wise every day. And when they get into that practice, as they get to start their own families, then it's not too hard of a job for their doctors to say, okay, listen, you got to get more fancy with what you're doing. So anyway, that's how I would probably start off with choosing which supplements my young people need and which are the most important that they might grab onto. It always is very important to eat a whole food, mostly plant-based diet, and what's more important is to have them watch you cook, watch you make proper choices, because they're mimicking us. If they see that you're taking an active role in making a choice on what to eat, when to eat, who to eat from, then they'll probably follow. And don't forget, they're going to be taking care of us, so you need them healthy, otherwise they'll be flipped around. And I do have some parents who have to take care of their kids even into adult life, but it's not that often. Hopefully this has been helpful. If you have any comments down below on your challenges or how you get past your challenges, put them down. Maybe we can start a discussion. But don't forget to give me a thumbs up if this is helpful, and subscribe to me for weekly words of wisdom. And I am done.